Hi, good morning Brito. My name is Lucy Cornia. I'm your invigilator for the OET speaking session on the 23rd of July 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Brito Rayfield.
And what is your candidate number, please?
My candidate number is 241544202.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How many patients is a full workload for you?
During my career as a nurse, I have found out that the number of patients that I'm comfortable handling is relative to the unit that I'm working on. In a highly acute ICU, I've worked with as high as 8 patients on the shift, and felt this was overwhelming. On a medical and surgical unit, 8 patients on the unit that I'm responsible for is low. No matter the unit that I work on, I have a great method in place for prioritizing the needs of my patients, and make sure that all of my patients' needs are met in a timely manner.
Talk about a time you had to communicate a complicated medical issue to a patient or their family. How did you go about relaying the message?
In my time as a rehabilitation nurse, I worked with patients that spanned a wide array of physical ailments. When it came to working with patients with joint issues, my team obviously knew the medical terminology for the femur, tibia, ulna, radius, and so forth. When talking about specific bones, joints and muscles with patients, I always made sure to point out where each was on their body, and talked about how each part functions. Using this method, patients were better able to understand how their body worked, and why their rehab processes were important to their overall health.
Tell me about the greatest challenge you have faced in your nursing career. How did you overcome it?
The greatest challenge I have faced in my nursing career thus far is when I transitioned from working in an outpatient family medicine clinic to a position as an inpatient floor nurse at the local hospital. This transition was extremely challenging, as caring for patients who are hospitalized required me to utilize much more of my nursing expertise than my previous job as an outpatient nurse. While this transition was very difficult at first, and there were many days that I wanted to quit, I persevered by staying calm, patient, and confident and studying up on my nursing skills, so I could provide the best care I could to my patients.
How you will hand over your long shift after caring for 8 high acuity patients as your colleague arrives to relieve you.
In this situation, even though I am exhausted, I would complete handover templates for all my patients, if I haven't already. This is especially true, because you said the 8 patients are high acuity, which means there's a lot the next nurse needs to know about them. I could never leave my patients without completing handovers, because not only could I not leave my coworker in a bad situation, but I also don't want to put my patients at risk. Last week, I was in a similar situation, where I had been so busy that I didn't have time to complete handovers until my coworker arrived to relieve me. So, I stayed late and completed the templates for all my patients, despite the fact that I was tired and ready to go home.
How do you handle being asked to do a nursing task you've never completed before?
I really want to be liked and be a contributing member of the team, but I always stop and do a check-in before enthusiastically saying, I'll do something I'm not sure about. I know the basics of nursing skills, so if I can look it up in the policy and procedure manual, such as a simple but different dressing change, I am able to do that independently. If it's totally novel, I will ask for supervision when first performing it, so that I always work within the scope of my nursing practice.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the roleplay is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the roleplay as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can start your roleplay now. Don't worry if I stop you when the time is up.
Hello, good morning, Lucy. I am Brito Rayfield, your nurse here today. How are you doing?
Good morning, nurse. I am good. Thank you for asking.
Well, Lucy, can I confirm the purpose of your visit, please?
Nurse, I am here to take my first B12 injection.
All right. You have been scheduled for a B12 injection, following the diagnosis of pernicious anemia, after the blood test. Is that correct?
Yes, nurse, you are correct.
Before getting into the procedure, I would like to know, how are you feeling now, Lucy?
Actually, nurse, I am still feeling tired and weak.
I am sorry to hear that, Lucy. Try not to worry. The treatment for your condition will make you feel comfortable, and successful completion of the course will help you to regain your health.
Okay, nurse, I too hope the same.
I appreciate you for being optimistic. Now, Lucy, for my clarification, please tell me how well you have understood your condition.
Nurse, I have just understood that I lack vitamin B12, and I will be provided with the B12 injection to compensate for it. However, I wish to know in detail about my condition.
That's great. No worries, Lucy. Your understanding is correct. Moreover, I am happy to provide you with detailed information regarding your condition.
Thank you, nurse.
Anemia is a condition in which the body does not have enough healthy red blood cells. And there are many types of anemia. Lucy, you have been diagnosed with pernicious anemia, which is a decrease in red blood cells that occurs when the intestines cannot properly absorb vitamin B12.
Oh, I see.
For your knowledge, the red blood cells provide oxygen to body tissues. When you lack them, your body will not supply sufficient oxygen, and makes you feel tired.
Okay, that's why I am fatigued.
Yes, you are absolutely right. Two main reasons for the condition can be genetic, or due to dietary patterns. If you can give me an insight into your diet, it will help me to identify your cause much better.
Sure, I will. Basically, nurse, I will not consume many fruits and vegetables. That is because I am very selective. Also, I prefer to have a minimal quantity and rely on processed food, since it is easy to consume.
Thank you for your information, Lucy. I can confirm that your dietary pattern is the major cause of your condition. Perhaps it can be managed and can be even rectified easily with dietary modifications.
Oh, is it?
Yes, Lucy. If you improve your dietary quality, this can be easily managed.
Please guide me through, nurse.
I am glad you asked me this question, Lucy. Surely, I will explain it in detail to you.
Okay.
The major source of B12 is fortified food. Make your breakfast with fortified food. Along with that, you can include dairy products and cereals. I can provide you with a leaflet containing B12 diet and recipes, which will be helpful for you.
That is so kind of you, nurse. I will include these in my diet.
Thank you for accepting my suggestion. Besides this, the treatment regime will help you to overcome the deficiency effortlessly.
Good to hear that, nurse. But, is it safe to take injections, nurse?
Yes, Lucy, of course, it is safe for you, and moreover, it is essential for your current condition. Intramuscular vitamin B12 injections are the best effective methods you can get.
Okay, that's fine.
Now, Lucy, I will outline your treatment plan.
Okay, sure.
As you know, you will be supplied B12 via injections. You will receive these intramuscular vitamin B12 injections 3 times a week for the first 2 weeks. Gradually, based on the observations, your dosage will be decreased over time. Finally, you will accomplish the normal B12 level, hence the injections will be stopped.
All right, nurse, I understand that. Is there any chance of getting extended medication, like lifelong supplementation of B12?
Your concerns are quite natural. There are some instances where you need lifelong B12 supplementations, either via injection or in oral forms. Instances such as, if your condition is genetic, as I told you earlier, you may have to take them lifelong. Or else, you have to take them until your B12 levels are normal.
Okay, I got it.
Lucy, to maintain B12 normal levels, I strongly recommend you to take the medication as prescribed by the doctor, and try to correct your dietary pattern, as we discussed. You can also take vitamin B12 supplements every day, between meals, to enhance the B12 level.
Definitely, nurse, I will follow the instructions.
I appreciate your willingness, Lucy. Can I get your consent to proceed with the B12 injection?
Yes, sure.
Thank you for your consent.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.